Good afternoon. I'm Michael Mize, student physical therapist at Campbell University. Today, I will be teaching and demonstrating the Apley's distraction and compression test. This test is used to assess individuals for pathologies involving the meniscus of the knee. The meniscus is an articular pad that sits between the femoral condyles of the femur and the tibial plateau. It provides structural integrity to the joint and protection from compressive forces and torsional forces. Therefore, this test evaluates the integrity of the medial and lateral meniscus in the knee. When a tear or degeneration in the meniscus occurs, the patient may experience pain, clicking, catching, or locking with limitations with movement. However, diagnosing meniscal injuries can be difficult as the menisci are avascular and have no nerve supply on the inner two-thirds of the pad, which can result in very little pain or swelling when an injury does occur. The diagnostic statistic of the test have been reported by Dutt in 2012 and Hegedus 2007 that this test is proved to be more specific than sensitive. Now I'm going to explain how the test is performed. The patient is positioned prone on a plinth with the knee bent to 90 degrees. The therapist can stabilize the patient's thigh to the table with either their hand, their knee, or a gait belt. The therapist then applies a distraction force to the tibiofemoral joint, followed by internal and external rotation of the tibia, noting any excessive movement, restrictions, or discomfort. The therapist then repeats the same process except with compression of the tibiofemoral joint, followed by internal and external rotation of the tibia. Always be sure to test the non-involved side first to have a baseline comparison of your findings. Positive findings of this test are as follows. If distraction with internal or external rotation is more painful or shows increased rotation relative to the normal side, this is more indicative of to be ligament injury. If compression with internal or external rotation is more painful or shows decreased rotation relative to the normal side, this is indicative to be more of a meniscal injury. Pain with internal rotation indicates lateral of the meniscus, and pain with external rotations indicates that it is the medial meniscus. Now I'm going to demonstrate and explain how I would perform the test to a patient. How you doing today, Lee? Good. Good. What I want to do is I want to check how your knee's doing. And I want to do a test on you that's going to check how when the leg bone, the tibia, turns on the upper leg bone, the femur. And we'll do this by, in just a second, I'll have you lay down and on your belly. I'm going to bend your knee up. And the first thing I'm going to do is I'm going to distract the knee, which is where I apply a little bit of a separation in between the two bones. Once I do that, I'm just going to rotate it in and out. After I do that, next thing I'll do is I'm going to push the two bones together and rotate it in and out. If at any point in the test you have extreme discomfort or anything you're uncomfortable with, just let me know and we'll stop. Does it sound good to you? Mm-hmm. Okay, good. Now if I can have you lay on your belly for me. Just lay there and relax. You comfortable? Mm-hmm. Good. Alright, just relax for me. Any of that hurt?
No.
Good. The findings for my patient's knee is normal, and that concludes my demonstration for the Apley's distraction and compression test.